A very good morning to all of you. A warm welcome. Myself, Dr. Gargi S Kumar. So I work as a project coordinator in a nero palliative and supportive care project in the National Institute of Mental Health and Neuroscience, Bangalore, India. Greetings from India. Thank you so much for the opportunity. The title of my presentation today is Establishing a Neuropalliative Care Clinic in the Hospital Setting, Lessons Learned from ALS Care. So to give a brief introduction about the study, so there's a growing interest in the application of palliative care principles to improve the care for patients and families affected by neurological diseases, especially ALS. So family being the significant constant of care in India, so the care model should ideally be tailor-made to provide care support for home-based care. So palliative care needs of people with ALS and families, so that can and should be addressed in an outpatient setting, which include discussing goals of care, caregiver support, complex symptom management, working with difficult emotions, and referral to other disciplines. So the care requires multidisciplinary targeted intervention. The concept of neuropalliative care and the setting up of clinic is something which is new in India, though it's been established in Western countries and all other countries. So in India, especially in South India, we are trying to establish a neuropalliative outpatient clinic, a specialized neuropalliative care services through a highly skilled and committed team who will deliver the services at the clinic and then through a structured follow-up services that can incorporate home visits and telephone follow-ups till end of life carers institute. So the main objectives are assessing the palliative care needs in chronic neurological patients, especially the ALS patients and their families, provide symptom management, physical therapy sessions, and pain relief, provide emotional, psychosocial, bereavement, and spiritual support of patients, their family members, and everyone, capacity building training and multidisciplinary palliative care team meetings, and the referrals and the follow-ups. So consensus building process is being started through a series of meetings with the senior investigators who form the multidisciplinary core team and meeting with the stakeholders and NGOs, meeting with external expert team, multidisciplinary case discussions, and so on. So the method is we describe the conceptualization, development, and implementation of a multidisciplinary outpatient neuropalliative care clinic in the public healthcare system in South India, building on the need identified from practice inside of the neuromuscular clinic and several parallel research projects. The clinic was proposed with three main objectives: to provide patient care services, to explore the needs, identify transition point to neuropalliative care, to develop capacity building programs and among different healthcare professionals, to identify and provide palliative care intervention for ALS. The clinic has actually started functioning in the month of December 2021, and till date, to the 210 patients with ALS and caregivers have been supported through the clinic. The clinic has grown steadily since its inception and maintains a high satisfaction ratings from patients, caregivers, and referral providers. To maintain a standardized and efficient care, we have developed materials for referring physicians as well as checklists and other processes used by our interdisciplinary team. So the common referral reasons, which include psychosocial support, symptom management, financial assistance, and advanced care planning. The care is continued through phone follow-ups and home care visits on need basis. So the current challenges which we have seen in our clinic is to develop a strategy for continued growth. So creating a model for interdisciplinary care is something which is quite challenging and it's difficult, though it's very essential as well. So integrating our services with the disease specific section is also a little challenging because neurological conditions, though it has been established in ALS palliative care, the other neuropalliative conditions have not been discussed so well. So improving the palliative care knowledge and skill within the referral basis is something which is also have to be focused, because many of the health professionals and other multidisciplinary team members are unaware of the need for neuropalliative care in ALS. And building effective alliance with community neurologists, nursing homes, and hospice centers is the major challenges to outreach to the public out there. It has to be go through some community work. So along with establishing the neuropalliative care clinic, so we have used a semi-structured interview as a pilot study to find out what are the spectrum of needs among this group. So, and we have identified so many spectrum of needs, and we kind of categorized into medical and physical, psychological, and social domain. Though there are so many other needs, so we kind of club together under these three heads. So under medical or physical heads, the high support need in ALS patients as they require more help in the areas of speech changes, weakness or wasting, difficulty in swallowing, communication difficulties, slowed movement, pain, walking disturbances, impaired posture and balance, breathing difficulty, sleep, and so on. There are so many. But in the psychological need, we have seen that the ALS patient worries about their future a lot, and they have a lot of cognitive disturbances, and that's also one of the concern for the patients as well as the caregivers. And in the social domain, lack of people, a lack of support, lack of social support to share their experience was a major issue felt by majority of the respondents. So to conclude about a very early developed establishment of neuropalliative care clinic is a specialized outpatient palliative care for ALS, which fills several important gaps in care for this patient population in the Indian context. It provides an important educational opportunities for trainees, and also it gives a lot of opportunities for patients and the caregiver centered research as well. So, and we need to have a lot of educational initiatives and that are needed to train general neurologists and other allied health professionals in primary palliative care. So we basically have to have a lot of sensitization programs about this neuropalliative care clinic, especially in India. And research is also needed to build an evidence base to identify patients and their caregiver needs, and also to support specific interventions and to build more efficient models of care in both academic and community settings. So with this, I end my session. Thank you so much for your listening. And this study has been supported by financially by CIPLA Foundation. I would like to thank CIPLA for this immense help, and thank you so much all. Thank you.
Thank you. Thank you so much. So, yesterday there was a discussion on multidisciplinary care, and we were talking about the future and adding different pieces, and palliative care did come up in the discussion afterwards, so this was a nice segue from that. Are there any questions in the audience or online? All right, it's early morning here. So I have a question about, just to clarify, so is the clinic already in place and palliative care is being added, or is it a different kind of model?
Yeah, thanks so much for the question. So the clinic is not been established. So clinic has actually been started as a neuropalliative care clinic. So
Okay.
there is no other clinic existing in this tertiary hospital in India. So we, as part of a project, so we have started a neuropalliative and supportive care clinic as such, with a set of objective, as I mentioned in the presentation. So the clinic is actually started off from the very beginning. So we did not have a infrastructure, we did not have a building, we did not have anything when we have started off with. So everything we have started from the scratch. So now we have come to a stage that we have something to speak about it.
Excellent, excellent. And did you have a great, like, response from therapists, like they wanted to come work there?
So I would say that now, yes, the therapist and the consultants and other health professionals are kind of ready to accept. But initially, when we have started off with establishing a clinic, it was quite challenging, as I mentioned in the presentation, because people are actually not aware of the fact that there's a need for a neuropalliative care in ALS. So in India, at least, people have always been equated palliative care with cancer patients. So they never realized that ALS patients or any chronic neurology conditions need palliative care as such. So to make them understand or to sensitize the population or the community, so that is the first and foremost task which is done by us. So everything started from there. So then gradually we have started establishing a clinic. Then so people have actually found that yes, there is a need for a neuropalliative care,
Wow.
especially in ALS.
Yeah,
Yeah.
so you had to start
So,
almost beforehand and do a lot of education first, and then,
yeah, we
wow.
did. Yeah.
Any questions? I could just keep having a conversation. They're saying it's impressive. All right. Well, then we will let you go and get back to your night.
Thank you so much. Thank you so much
Thank
for
you
the
so
opportunity.
much.
Yeah, thank you.